Did you know that heart disease is the #1 killer worldwide? It's responsible for millions of deaths every year, and what makes it even scarier is that most people don't even know they have it until it's too late. It creeps up silently, often disguised as something minor or unrelated. That's why understanding the hidden signs of heart disease is absolutely crucial. In this video, we will reveal 10 hidden signs of heart disease that you absolutely must take seriously. If you experience any of these, it's time to listen to your body. Because it's not just about knowing the symptoms, it's about knowing when to act before it's too late. Let's dive into these warning signs so you can take control of your health and prevent a tragedy. 1. Unexplained fatigue. Fatigue is one of the most overlooked symptoms of heart disease. We all feel tired sometimes, but when fatigue strikes without any apparent reason, it can be a serious warning sign. Think about it. Are you feeling completely drained even after a full night's rest? Do everyday activities like going up a few flights of stairs or walking across the room leave you winded and exhausted? This is because when your heart is struggling to pump blood efficiently, the rest of your body doesn't get the oxygen it needs, leading to chronic exhaustion. If you're constantly feeling drained, it's time to take a closer look at your heart health. 2. Shortness of breath. Shortness of breath should never be dismissed, especially if it happens after light exertion. We often think of shortness of breath as something that only happens when we run a marathon, but if you feel out of breath after light physical activity, your heart might not be keeping up with your body's needs. For some people, this can occur during rest or even while sleeping. When your heart is unable to pump blood properly, oxygen delivery to your body is compromised, making breathing harder. If you experience unexplained shortness of breath, it could be an indicator of heart disease. Don't ignore it. 3. Chest pain or discomfort. Chest pain is often associated with heart disease, but not all chest pain feels the same. While a heart attack can indeed cause sharp, intense chest pain, heart disease can also cause a subtle, dull discomfort in your chest, which may last for several minutes or even longer. This discomfort can feel like tightness, pressure, or a heavy weight on your chest. If you experience this type of discomfort, especially if it occurs after physical exertion or if it comes with other symptoms like nausea or shortness of breath, don't take it lightly. It could be a sign that your heart isn't functioning optimally. 4. Swelling in your legs, ankles, or feet. Have you noticed your legs, ankles, or feet swelling, especially by the end of the day? This might not seem like a serious issue at first, but it's actually one of the most significant signs that your heart is in distress. When the heart is not able to pump blood efficiently, fluid can build up in your lower extremities, causing swelling. This is your body's way of trying to compensate for poor circulation. If you find yourself dealing with unexplained swelling in your legs or feet, take it as a warning sign and see a doctor as soon as possible. 5. Irregular heartbeat. Does your heart ever feel like it's skipping beats or beating out of rhythm? An irregular heartbeat or arrhythmia can be a clear indication that something is wrong with your heart. When your heart isn't beating in a normal rhythm, it may not be able to pump blood efficiently, which can lead to other complications. If you experience frequent or persistent irregular heartbeats, dizziness, or a fluttering sensation in your chest, it's important to get it checked out. 6. Cold sweats for no reason. Cold sweats might be something you only associate with illness, but they can also be a sign of a heart issue. If you suddenly find yourself sweating excessively, even though you haven't exerted yourself or are not running a fever, this could indicate heart stress. When your heart isn't functioning well, it can cause your body to go into overdrive in an attempt to compensate for the lack of oxygen, triggering cold sweats. If this happens with any other symptoms, like chest pain or lightheadedness, it's time to seek medical attention. 7. Lightheadedness or dizziness. Feeling dizzy or lightheaded, especially if it occurs suddenly or frequently, could be a sign that your heart isn't pumping enough blood to your brain. This drop in blood pressure can cause you to feel faint, and in extreme cases, may even lead to fainting. If you're getting lightheaded or dizzy without any obvious reason, such as standing up too quickly, it could be a sign that your heart isn't doing its job. Don't wait for it to get worse. Get checked out by a doctor. 8. Nausea or vomiting. Nausea or vomiting, particularly when it occurs alongside with other symptoms like chest discomfort or shortness of breath, could indicate a serious heart issue. While it may seem like an unrelated stomach issue, heart disease can sometimes manifest as nausea, especially in women. The discomfort you feel in your stomach can actually be a referral pain from your heart. If you experience nausea along with other symptoms, don't wait. Seek medical advice immediately. 9. Pain in other areas of the body. Heart disease doesn't just affect your chest. The pain can radiate to other areas of your body, including your arms, back, neck, jaw, or stomach. This is because when the heart is in distress, it sends pain signals to other parts of the body. If you feel any unexplained pain in these areas, especially if it's accompanied by other symptoms like shortness of breath, dizziness, or nausea, it could be a sign that your heart isn't terrible. Always take pain in these areas seriously, as it might indicate a heart attack or impending heart problem. 10. Sudden weight gain. Sudden, unexplained weight gain, especially if it's rapid, could indicate that your heart isn't pumping blood effectively. Fluid retention can occur when your heart fails to circulate blood efficiently, causing your body to retain more water than usual. If you notice sudden weight gain, along with other symptoms like swelling or shortness of breath, it's important to see a doctor right away. The sooner you catch it, the better chance you have of preventing serious complications. Heart disease is often referred to as a silent killer because it can progress without obvious symptoms. But by recognizing these 10 hidden signs, you can take control of your health and seek medical attention before it's too late. Early detection can save your life, so don't wait for the symptoms to get worse. If any of these signs sound familiar, it's crucial to act now. Talk to your doctor, get checked out, and take the necessary steps to protect your heart. Your health is your most valuable asset, and taking care of your heart should be your top priority. If this video helped you or opened your eyes to something important, don't forget to share it with others. You might save a life today. And if you want to stay informed on how to protect your health, hit that subscribe button for more life-saving tips. Stay healthy, stay safe.